Sienna 2025. Come and have a unique experience in Dallas, Texas.
Ago na miapete milemiakpe bemifa 32nd annual Sienna Convention Le Dallas Fort Worth. Dallas. Big D. Mifa yapakpong tepe.
Aha. Sienna 2025. Mano bobo edolo. Mifa midwaza. We want me at the Cornwall Friday evening. Sunday me our picnic. Me our church service. And all les zanzazata miniva.
Tata nyo play for you, mi do bonsoir na mi lo. Mi do bonsoir na mi apata, mi de kuku na mi be mi kro mi ape famille o valo. Mi kro mi ape famille o mi afa po Dallas da. Mi adu azan. Azalo.
Azase.
Azale kongbe.
Azale wow.
Hello. Welcome to the Health and Wellness Hub. My name is Miss Dell, and this is Sienna TV, or Sienna Media channel on YouTube. So if you're watching us from wherever you are, kindly share and subscribe to our channel. Okay, so today we are back by the grace of God, and we're going to be talking about stroke. Yes, we're going to be talking about stroke. So and we have a lovely lady and sister here who is going to be educating us on stroke. You know, what to do or what not to do to avoid it, or even if you have it, how to manage it. So that's what we're going to be doing today. Akpena mi miawezo egbe stroke nya dogbe mi gbo enkonyenye Miss Dell mile Sienna TV play radio Gile YouTube channel. Danele mi akpo egbe merekuku share it. Now amedecheni say so we can all educate ourselves. You share and you subscribe so our channel will go far and help other people as well. Akpena mi that abele me know every time. Me no vida Sarah. And me motivational message. That will go straight to her. Akpena mi.
Mi hofiai nyaselao akpena mi be bileunse domi de miabo nuhlamo ple ala mesese nyake o mikov buena mi egbe la ejidepo nyake mejibe makove na mi enyebe madon kuji na mi enya vivi do mi ejedo mi do hovai maga mi abosu suva jibela eleve viere bela esia ila miga no jukudo juku dodo lava ba gakela lemi do jukuola ejebe mi dasile won labe biblan toche glebela enwuni gake de mi abo jukun ti o dala menye nusiano la doji jona mi o gake ne jukuova chela mi sro be mi adasile won mi sro be mi akochochoke akokpo mi adokwe la bezigede la jiku kemiola edie dolele alame na mi yeta oleve viede bere mi adasile jikun akochochoke akonoi akokpo mi adokwe ople mi anovi ople mi avio mi akolonlon akokpo mi adokwe ople mi avio londokwe ne londokwe la kemi lantan lonovi abele bi black blela azon che mejibe madon kujina mi bela miji nukemio hi adojijo nami miji nukemio adojijo nami nukemio la mi no wo isi ai miji eyiyi lenkekieme alo le kosila me alo le tieme alo le efieme bela miaji wonado hi mia awo akodo jijo na miadokwiyo mano do wo dede o nyakemi komejibe maga kwide me na mibela mano do wo dede son ko gakela mia akpogbo bela miji eyiyi akogdide me aji eyiyi akogbode me aji eyiyi akokpo jijo ne lonlade la siola mi pojijo mi awon lolon elabe lolon wo chela pede amenupa ela nawo lupo pele wo jipete wa mi ento pete la jela no ojo kemela manon kumeyon Yela ma chicho chichima jelo won ela be isi ayila ele jijopo ele lon lowo ela mo lon le doki o lon nusianu la liji nuere ela be wo susu pete nyebela alon amesiame mi anai le wunte fafa me ta nyenya kuyere gbe kwenye bele miji eyi ne mi pojicho ne mi wolonlo lo.
All right, akpenami. Mia da mia novi Davi Sarah be me GAE me wolonlo me no novi and have time for ourselves. That's our message for this weekend and our motivational message from Davi Sarah akpenami. As I said, abele megbloi egbe stroke nyagblɔ ƒe migbo. Yeah, we're going to be talking about stroke, how to manage stroke, if you have it or if you don't have it, how to avoid it. We have here a very seasoned Davi Edna Nuna Tamaklo. She is a neurology nurse. Nyamanyale madole fogbemuga. Neurology, open a kidney, right?
Urology in your kidney.
Kidney,
Neuro in your brain and spine.
Oh, brain and spine.
Yes.
Okay. All right. So that's what she does. So today, Egbe, she's going to be talking to us about stroke. Davi Nuna, Davi Tamaklo. Very cool. I'll give you the opportunity to talk to us about stroke.
Okay.
Yeah, please go ahead.
Okay. So am I allowed to speak English?
Yeah, you mix
English.
Yeah, I don't mix it up.
Mata mix it.
Yes.
Okay, stroke.
Yeah.
So we're gonna talk about the basic knowledge so that now Madam medical field asagoma. So I've been able to try to narrow it down to easy words and no medical jargons. So stroke, the basics, the content of this presentation, the goal of it is to explain the evidence-based information regarding stroke. What is stroke? Type of stroke, risk factors of stroke, labs and imaging required to rule out or diagnose stroke, and special care after stroke, just in case you have any family member here or back home with stroke. At least there are some questions. No, did they do this? Did they do that? To make sure they're on the right path. Okay. I'm starting off by asking, what is stroke? A stroke occurs when a blood vessel is blocked or bursts in the brain. During a stroke, oxygen-rich blood supply to part of the brain is decreased. Brain cells become damaged and may die, depending on the time. In a medical point of view, it is known as an acute onset of focal neurological deficits caused by an occlusion or hemorrhage of a vessel that supplies to the brain. So we talked about a block or a bleed. If you see right here, you can see this artery here, it's in the brain. This clot right here blocks blood to flow through the other one. So, and then this one of the vessels, something happened and there's a brain bleed. This one we call the ischemic stroke when there is a blockage, or we can also call it embolic or thrombotic. And we also have the hemorrhagic stroke right here. There are two different, we do have another one called the subarachnoid or intracerebral. Someone will ask, is stroke serious? Yes, stroke is very serious. A stroke is a medical emergency, and early treatment may help to restore or improve blood flow to the brain. This may decrease the damage to the brain. Annually, 15 million people worldwide suffer a stroke, and sorry about that. They suffer a stroke, and of these, 5 million die, and 5 million are left permanently disabled. Stroke can be a life-changing event, and fortunately, most people get better. The road to getting better can be short or long, and often very, very, very bumpy. So this is our brain. The brain consists of so many lobes. We do have the frontal lobe, which is here, the parietal lobe, the occipital lobe, the temporal, which is on the sides, the brainstem, and the cerebellum. Now, just a little bit to let you know what the functions of each lobe is. So the frontal lobe, there's movements such as arms lifting, when you can lift your arm, when you're able to focus your attention, social and sexual control, able to speak, and decision making. The parietal lobe, which is on the side, awareness of your body parts, math skills, naming objects, and eye-hand working together. Occipital lobe is when you're able to see and understand what you're seeing and reading. One thing you're able to see, the other thing you have to understand what you're seeing. And then temporal lobe, short-term memory, understanding speech, you can recognize faces, it's on the temporal lobe. And then the cerebellum, movement, balance, body part working together. You know, when you're walking, a normal person, when you're walking, when your right leg goes forward, the left arm goes back. It works in sequence. And then the brainstem, eye movement, message relay center, heart and breathing center. That's what the brainstem is for. Now, are there different types of strokes? Yes, there are 3 different types of stroke. The first one, we have the transient ischemic attack, which the medical field, we just say TIA, and is when blood flow to the part of your brain is blocked for a short term. This is a warning sign. People who have TIA may have a stroke in the future, causing lasting damage to the brain. A little bit about that. The person will have symptoms by the time they get to the hospital, the symptoms are gone. They'll still want to admit you and monitor you for a couple of days. So don't be stubborn, just wait and let them do what they need to do. The second one is an ischemic stroke. It's the most common type. It is caused by blood clot that blocks blood flow to the brain. And then the third one, we have the brain bleed. That's the hemorrhagic stroke. There are 2 types of this one, of the brain bleed. The first one is the intracerebral hemorrhage. We call it ICH in short, which is often caused by high blood pressure. And then the second one of the brain bleed is the subarachnoid hemorrhage, SAH, which is often caused by ruptured aneurysm. So I just have some pictures here for you to see for yourself. When you talk about ischemic stroke, this is what it looks like in the brain. And then hemorrhagic stroke, you can see that little tear in the artery and the blood start leaking into the entire brain. And then the TIA, this one, which is caused by the temporary clot, often called a mini stroke. It's a little blockage right here, and then this whole part of the brain that the vessels are supposed to supply blood to is cut off. So let's see the next one. Okay, now we're going to take each one of them and break it down to know what they are. The TIA, which is a transient ischemic stroke, is an episode of temporary focal cerebral dysfunction due to a vascular disease. Usually resolves with no permanent damage. Resolves quickly with no MRI evidence of stroke. It's a significant warning sign of impending stroke. Symptoms are, most of the symptoms, sudden of everything, sudden numbness or weakness in arms, and especially on one side of the body, sudden confusion, trouble speaking and understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, and sudden headaches with no known cause. If you see all these things, they are warning signs. Now, the ischemic stroke. It accounts for 87% of all strokes. It is a form of injury to the brain. There is a saying that the brain is being attacked. It is the most common type of stroke, which is caused by blood clot to any part of the brain. The particular type of degree of the neurological deficits incurred depends on the particular area of the brain involved, because the brain is composed of the highly specialized tissue in the body. Now, the signs and symptoms of ischemic stroke: face drooping, you realize the lips are not in line, will be droopy on one side. And then there's slurred speech. Some of the family members will say they're speaking gibberish. I don't know what they're saying. And then there's loss of balance. You might find them dragging one side of the body. And then trouble seeing. And then they will say they're having severe headache. You're supposed to take all these complaints or symptoms really seriously. So treatments. There's something we call TPA, which is the tissue plasminogen activator. Some patients may benefit from TPA. It is a medication given intravenously to dissolve the clots and help restore blood flow. TPA works better if given soon after stroke symptoms begin. 1 in 3 patients show improvement in their stroke symptoms, and patients receiving TPA are monitored closely for bleeding, which is the most common side effect. So a patient like this, when they come to the hospital, they will ask, do they have any bleeding disorders? Are they on any blood thinners? Know the medications you take, know the side effects, know if you have medical history. You should be able to know those things. When the doctor says it, know them so that you'll be able to tell the doctor. Even if it's a family member, know what your family members' medical histories are, because it really, really helps the medical team to know if they are good for this medication or not. And then there's a procedure called the clot retrieval or thrombectomy. It's like a tiny tube or catheter is placed into a large leg artery and steered into the vessel in the brain. X-ray and dye will be used so that the doctor can see the vessels and clots. This procedure is done under general anesthesia, so a consent will be needed for that. Patient will be monitored in ICU after this procedure, and then there is a risk of bleeding and death. Again, they have to know if you have any bleeding disorders before you can qualify to have this procedure done. Antiplatelet agents. This is the most common ones. Aspirin, Plavix, Purpose is to decrease clamping and clot formation. It reduces the risk of stroke. Side effects can be bleeding, bruising, and stomach upset. Now, when you have the symptoms, you go back home, you're fine. When they put you on aspirin, there's a reason why you are supposed to be taking the aspirin. So take it and then make sure you monitor for any side effects. Now, hemorrhagic stroke, basically known as the brain bleed. Approximately 8 to 13% of strokes are hemorrhagic stroke. We have the intracerebral hemorrhage, ICH, which is 10%. It's a type of hemorrhagic stroke resulting from blood leaving the vascular system and entering the blood tissue. Primary ICH includes hemorrhage resulting from hypertension. Secondary cause of ICH includes vascular malformation or abnormalities. It could be trauma, tumors, and coagulation disorders. Again, coagulation disorders if you have any blood disease. Intracerebral hemorrhage is associated with significant morbidity and mortality and constitutes a neurology emergency. It's very emergent. Anyway, note, patients with acute ICH are usually admitted to ICU environment because they are often physiologically unstable and high risk for complications and require frequent careful assessment and monitoring. Then we do have the subarachnoid hemorrhage, which is 3%. It's bleeding into the subarachnoid space, consisting of the cerebrospinal fluid, major blood vessels and systems, and primarily the results of ruptured cerebral aneurysm or trauma. If you see this brain right here, this beautiful brain, there's a bleed that is starting to smear everywhere, and that's what it looks like on imaging. Some treatments for hemorrhagic stroke. Treatment depends on severity. Emergency treatment is needed for cerebral hemorrhage. Patients are initially monitored in ICU, managed with medications, and in rare cases, surgery is performed to relieve pressure around the brain. Medications, there is antihypertensive to reduce blood pressure like hypertension, and diuretics to reduce intracranial pressure. The brain turns to swell up, so they have to reduce the swelling. Fever and headache may occur, and it's treated with acetaminophen, as we always call Tylenol, as needed. And then there is a procedure called surgical clipping. Surgical clipping is an invasive surgical procedure. It requires craniotomy. Craniotomy is they're going to open into the brain with surgical placement of a clip at the neck of the aneurysm. Like if you can see this artery right here, the aneurysm started here. So that's the clip that they used to clip it so the bleed can stop. And then we do have therapies, which is rehabilitation. They said, know the signs of stroke and act fast. We have this acronym that we say, be fast. Remember time is brain. That's what we say all the time. Be fast. Better stroke outcome begin with fast stroke recognition. B as the acronym, we have the B, E, F, A, S, and T. B means balance. When you see these changes on anybody at home, B, does the person have sudden loss of balance? Does the person have sudden blurred vision, double or loss of vision on one eye or both? Now the F for face, ask the person to smile. Does one side of the face droop? Now the arm, ask the person to raise both arms. Does one arm drift downwards? Speech, ask the person to repeat a simple phrase. Is their speech slurred or strange? Like someone who say they're just speaking gibberish. And then time. If you observe any of these signs, call the ambulance fast, because when you get there, they will ask you all the time, what time did you see this person last normal? What time did you see this? What time did this happen? The time helps them know what to do when they get to the hospital. Like I was saying, but Nana, you see any of these symptoms? Yes. Amara blogger, but Amara will waste time saying they're praying. I also believe in prayers. Why are you 911 before you start praying? Because the paramedical team will help you more as well. Now, the risk factors of stroke. Stroke can be prevented by controlling your risk factors. The following are the common risk factors of stroke. Now, we have the modifiable factors and the non-modifiable factors. Modifiable factors are things you can modify, you can prevent. And the non-modifiable ones, you can't. What are the modifiable factors? High blood pressure. If you have high blood pressure, you got to control it. Atrial fibrillation. I will go through all of these so you know what it is, what the normals are, and what to expect when you do a lab work. Atrial fibrillation, diabetes, high cholesterol, overweight or obesity, obstructive sleep apnea, smoking, too much alcohol, and street drugs. These are things you can manage. If you have it, you know how to manage it. If it's high blood pressure, medication, these are things that can be managed or avoided. And then the non-modifiable factors. If you've had a previous stroke like a TIA, and then age, that one you can't do anything about it. You either grow older or you die before you get older. So you want to age gracefully. And hereditary, race, high risk in those with African descent, like myself, Indo-Asians, Hispanics, and then gender. Now listen to this. Gender-wise, research has shown that there's increased risk in men, but higher number of stroke death occurs in women. It's a research based. Okay. Now, high blood pressure, we're going to take one at a time and talk about it. High blood pressure, also known as hypertension, is a lifelong condition and the most common cause of stroke. If uncontrolled, your risk of stroke is higher. Keeping your blood pressure normal will lower your risk of stroke. You and your primary care provider, that's your doctor, will need to work together to meet this goal. Take your medications every day as directed if you're hypertensive. Don't stop medicines without talking to your primary care provider. Now, this one, my own relatives and probably friends' relatives, they always do this. Like, you have a blood pressure medication, a history of TIA, they don't take it, and then boom, another stroke comes. So when you have history of high blood pressure or you have history of TIA, make sure you take the medications and then take it as prescribed. Don't stop unless you have orders to stop at a certain parameter of your blood pressure. Now, see your primary care regularly. Check your blood pressure on a regular basis. Some people do it Monday, Wednesday, Friday. Some others do it every day. It all depends on what's going on with you. And then track your blood pressure readings and bring to your primary care appointments. And then follow a low salt diet, limit alcohol, exercise daily, maintain a healthy weight. Don't use street drugs. When you keep track of your blood pressure readings, especially if you're hypertensive, taking blood pressure medications, you have appointment coming. It really, really helps a doctor to know if the medication prescribed for you is working or not. There will be days that you have one high blood pressure. Maybe you went for a walk and came back. Someone got on your nerves. You got so angry, your blood pressure shoot up. So when you check it other days, it might be different. But if you just check blood pressure once and it's high, you don't have any other records and you go to the doctor might not have a good history to manage what kind of medication to be prescribed. But when you have a record of like a week or two, or you have specific days you take them, you can also add some of the blood pressure readings, like you took one that was really high, different from all the other days. You can write whatever happened before you check that blood pressure, or after shower, or after a walk, after something, or you woke up and it's so low. You can write a little note next to it. You just woke up and you check that one. It really helps a doctor a lot because they're not there with you 24/7 to know what's going on in your life. Okay. Now, atrial fibrillation. Someone will say, what is that? Atrial fibrillation is an irregular heartbeat. Your heart may also race. In medical terms, we call it palpitation. You can feel it without checking your blood pressure. In atrial fibrillation, blood pools inside your heart and blood clots may form because of the pooling of the blood. These clots can break loose, travel to your brain, and cause a stroke. So you see that one too. And then things you can do. Your primary care provider or your doctor may recommend a loop recorder, which will monitor your heart for an extended length of time, approximately 6 to 3 months, depending on the severity or what you said to the doctor, Yeah. Treatment often include medicine to make your blood pressure less likely to clot. And these medications are called anticoagulants. Tip: if you have a racing heart or palpitation, don't wait. Go and see your doctor. Always see your doctor when you have these things. Now, if you see these two EKG rhythms, this is a normal heart rhythm. You see, it looks perfect. But this is somebody else who's someone who has atrial fibrillation. You can see that it's so irregular, very, very irregular. This is not good. So when you go and you complain, they will do the EKG first and see the rhythm, and then they will move from there. So it's very necessary for you to go and seek a medical attention from your doctor. Diabetes. When you have diabetes, your body has trouble using the energy from the food you eat. This problem is tied to how your body makes and uses insulin. Insulin is made in the pancreas. Insulin keeps your blood sugar in normal range. Diabetes increases your risk of stroke as well. It's like everything does. Almost everything, not everything. Improving blood sugar can decrease your risk for another stroke. What to do to prevent stroke if you have diabetes? Test your blood sugar as instructed by your primary care provider. Follow a meal plan. Take your medications as ordered. Exercise. Avoid high blood sugars. And be sure to do your regular checkups. I have this glucometer right here that is commonly used, but in today's world, there is a patch that they put here under your skin and is outside. It has a little thing outside that is connected to your phone. So you don't have to poke yourself every day. It's very good for the diabetics that I've talked to at the hospital. It's good because some people don't like poking themselves to check. Some of them I think are covered by insurance. It depends on what insurance you have. But if you're diabetic, look into that. If you have an endocrinologist who follows it, please ask them if you can have that one. That one is less painful. Okay, let's move to the next one, which is high cholesterol. High cholesterol causes plaque to build up in the arteries. It's a condition called atherosclerosis. Plaque can break away from the wall of the artery and travel to the brain, causing a stroke. Things to do when you have a high cholesterol. Cholesterol lowering medication help to decrease your risk of stroke by reducing the cholesterol levels in your blood and reducing your risk of plaque breaking off from walls of your arteries. Your primary care physician may prescribe statins. We have lovastatin, all those statin medications can help lower cholesterol and reduce the risk of stroke and heart attack. Now, some patients complain about side effects of the statins. Now, if you start having side effects, some people say muscle ache, they get nauseous, bring them up to the doctor, because if the doctor doesn't know, they might not help you. If they know, they can change it to another. Some are better than others. One who work for maybe your twin sister might not work for you. So if someone is taking a kind of statin and you asked for it, it was prescribed for you, and you're having side effects that the other person doesn't have, go back and report it so that they can change it for you. Now, talking about plaque, this is a normal artery. You can see that beautiful blood flow. And then this is the one with the plaque, a high cholesterol person. You can see the plaque right there. Now you see how it affects the artery. It has limited space for the blood flow to flow freely like in this one. So that's what it looks like, cholesterol in your arteries. Obesity or overweight. Being overweight or obese is a risk factor for stroke. Lack of physical activity and poor diet lead to being overweight. BMI, which we use, is called the body mass index. It's one way to determine if you are at a healthy weight. BMI. So when you go to the doctor's office, you remember they will check your height first, they will check your weight, and then they will check your blood pressure and everything. At the end of the day, when they give you the after visit summary, you see your blood pressure, pulse, every reading, and then the BMI is actually on the paper they always give you to take home. So always look at that. Now, if you want to know how to calculate your BMI, but if you go to the doctor's office, you don't need to do that math at all. It comes on your printout AVS form. So try to keep your weight as normal as you can. Sleep disorders. When sleeping problems go on for a long time, they are considered sleep disorders. Having a sleep disorder can be frustrating. It can make you feel tired and cranky. One serious condition, sleep disorder, breathing, increases your risk for another stroke. Why? Okay, now we do have the daytime symptoms for sleep disorder, breathing, and we have the nighttime symptoms of sleep disorder, breathing. Now the daytime symptoms, daytime sleepiness, memory or attention problems, headaches, fatigue, depression, and extreme sadness. All this, just you not having enough sleep, all these things can come up. That's why sleep is very important. And then loud snoring. Someone who snores doesn't have a good sleep. Waking up often during the night, increased sweating, premenopause or menopause can cause that too. Shortness of breath, unable to fall asleep or remain asleep throughout the night when you have all other problems going on, the problems you can't fix. It's hard to say don't think, but try. If you need help to sleep, you can also tell your doctor there's sleep aids that they can use, they can prescribe for you, or you can do natural things like not using your phone some hours before you sleep. Make yourself comfortable temperature, take a shower. Some people say warm milk, whatever that can help you, do it. Now, treatment varies, and some option can be losing weight if you're overweight. Avoiding alcohol and sleep medicine, it depends on which kind of sleep medicine. Some you have a rebound. You take it today, a couple of days. When they say don't take it over a week, that's when you have a rebound. You take it, it helps you, then another time you take it, it's not working. Always seek a medical advice. And then wearing a special dental piece at night. That one is probably from the doctor if they think it will help you. And then sleeping on your side instead of your back, that helps some people to sleep better. Using a continuous positive airway pressure, we call it CPAP machine during the sleep. But before you have that sleep app, they'll have to do a sleep study on you. They'll do all that and see if you qualify for it. Before it has to be ordered. You can't just get up and buy it. CPAP is a form of breathing assistant, and the CPAP uses air pressure to open up your airways. Most couples, the one that has a sleep apnea, usually they don't know. So the other significant other or the spouse or whoever sleeps maybe next to the person or maybe another room can report the sleep apnea. Oh, I saw you stop breathing during your sleep for a second. You snore so much. I mean, when someone tells you that, your spouse or friend, whoever, family member, take them seriously, because you can seek a medical help to have you sleep better. Then you can focus better during the day. Your headaches and all those frustration can end. All right, smoking. Nyamakada jiba mieva o mie smoke na smacho gakra. Na mother smoke na manyo. Smoking is a risk of stroke. Smoking is one of the hardest habits to break, but one of the most important habits to stop. Yes, tips to stop smoking. Make your quit date the day you had the stroke. That should scare you enough to stop smoking. Ask others for their support. Make a quit smoking contract with a friend. I had to do this with a few nurses. If you go like a month or every 2 months, if you haven't done it, we have a gift for you. It keeps them going. They just need someone who will motivate them, you know. And then list your smoking triggers and plan how to cope with them. Someone is just a little stressed and then they start smoking. So if they know their triggers, they can try not to let it happen. Now, talk to your primary care provider about using quit smoking products such as the gum and the patches. They have nicotine patch that they use as well too. Too much alcohol. Too much alcohol can increase your risk for stroke, very much so. Alcohol contributes to several medical conditions that are risk factors for stroke. Alcohol-related risk factors are high blood pressure, diabetes, being overweight, and liver damage. That everything has its consequences. Street drugs. Drug use, such as cocaine and other street drugs, increase your risk of stroke. Cocaine and other stimulant drugs increase your heart rate and blood pressure, causing damage to your blood vessels. Over time, these damaged blood vessels may leak, just like the hemorrhagic stroke, or burst and cause bleeding inside your brain. If you don't know what a street drug is, cocaine, amphetamines, methamphetamines, opiates, and ecstasy. Do I know if you're ready?
Okay, ready.
Ready?
Yes.
Okay. Okay, lab tests, imaging, and procedures. When stroke occurs or is suspected, your physician will order tests to help determine the cause or to help diagnose or rule out stroke. These tests will help the team to treat and educate you about prevention of another stroke. Common lab tests are lipid panel to detect cholesterol, AGB, A1C, determine 3 months average blood sugar level. If you're a diabetic, it will indicate how well your blood sugars are being controlled. Other tests, EKG, this shows the pattern of electrical activity in the heart. Electrodes are attached to the chest and electrical activity is transcribed. Now, imaging, we have CT scan. It's used to rule out brain bleed on arrival to the hospital. It uses X-ray to produce the 3D images of the brain. Let me see if I can. And it will show ischemic stroke after 24 hours in 10 minutes. And then we do have the CT angiography, similar to CT scan. An injection of contrast known as a dye is given to provide visual images of how blood flows through the blood vessels of the brain. And this can be done it can be seen within 15 to 30 minutes. So time helps in everything. I don't know why I couldn't go to the next one. Okay. We do have MRI, magnetic resonance imaging. People say MRI, what is MRI? It's the full name for MRI is magnetic resonance imaging. It's used to diagnose location of the ischemic stroke and other problems involving the brainstem, and the spinal cord. If you remember the brain, everything that I showed about the frontal lobe, all the lobes, MRI will show the specific spot where the clot is or where the bleeding is. So MRI is very, very helpful. It uses the magnetic fields to produce a 3D image of the brain in more detail than the CT scan, and this takes 45 to 60 minutes. Carotid ultrasound shows if the carotid artery is narrowed. You remember when the plaque narrows the artery? That's what it detects. Narrowed due to the atherosclerosis. Cholesterol will cause that. Then ultrasound waves are used to take a picture of the arteries in the neck to show blood flow to the brain. And this takes 15 to 30 minutes. Now, mind you, when a patient comes to the emergency room and they call a code stroke, everything they do, time. They follow time with everything so that they can try to help the patient. Anyway, echocardiogram helps identify problems with the heart. Ultrasound waves are used to take picture of the heart and circulating blood. This takes 30 minutes to an hour, depending on what's going on with the patient. And then we do have the diagnostic cerebral angiogram. This, they don't do as much, but they do it as well. X-ray images show any abnormalities, including narrowing, blockage, or malformation of the blood vessels and the brain. A catheter is inserted in an artery in the arm or leg, and a special dye is injected into the blood vessel leading to the brain. And this is an invasive procedure under conscious sedation. This thing keeps... I don't know, my thing froze.
Oh,
I don't know. Wait, let me keep trying here. Oh my goodness. Oh, okay. I think I got it.
okay, back.
Okay. Okay. Let me go back and say something about imaging. Imaging, when you're here in America and you send a family member to the emergency room and all these things are done, it's good. They know what you're doing. However, na family member la shio la fwa, ye oba okodanya, mamanya, togbinya, fofonya, whoever to the hospital. It's different. Not only for you know, amanya nanaka about stroke. Please try to encourage them. Have they done this? Oh, MRI, oh, CT scanner, oh, hey. It all depends on which hospital they take their family member to. We have come to realize, but not only though you have qualified medical doctors. I mean, this doesn't happen everywhere. Sometimes it depends on the money because it's a cash and carry system. They just want to do what the family members can afford. I mean, if you're here and you're the one supporting them financially, no kwama a hospital, you know all these symptoms are stroke symptoms, they're suspecting something. Bia alo me kwama a hospital jagwagwana blonoba no wo hey no wo hey wo CT scan na wo MRI no echocardiogram, whatever. Try to help the family member to ask. Video call G and you want to talk to the doctor in your family member's care, but you no wala. It really, really, really helps, you know, for them to do the right thing to arrive at a good diagnosis. Okay, recovery after stroke. If you're recovering from stroke, depending on the area of the brain and size of the injury, patient may experience problem with energy, thinking, and they have emotions all over the place. There is feeling of sadness, anger, anxiety, and at times they become suicidal. Here is someone who can walk by themselves, feed themselves, do so many things for themselves, and then all of a sudden they're paralyzed. There's so many things they can do. It's very depressing. So you really have to be very supportive to them. Things to do, they have rehab, physical and occupational therapy. Staying active helps increase strength and endurance. It helps regain independence as possible. And it improves memory and thinking. Spend time with a family member and friends. Eat healthy, maintain intimacy, join a support group. It really helps. Exercise, walk with your feet wide apart, and then do exercises prescribed by your therapist. Now, I'll elaborate more on this. Now, therapy at the hospital, therapists, they come and do evaluation and then they recommend go to rehab. If they say go to rehab, you need it. Don't say, I can do this by myself. I can do this by myself. When you go to rehab, you have more intense therapy that can help you regain more of your functionings back. So when it's prescribed, do it. Home safetiness. Now you have a stroke family, a family member who has a stroke, and then they are discharged to go home. Managing life at home is a part of stroke recovery. To live well after a stroke, you may need to make some changes to your home and daily routine. Some safety tips: remove your throw rags like carpet or replace with the non-skid rags or mat. Create clear pathways by removing furniture and cords. Ensure the rooms are well lit. There's so much light. They're saying this because I may have a stroke. For I affect my vision. I'm not gonna look on my bed channel. They can't see clearly. You need more light. If the house is cluttered before that patient discharges from the hospital, One person needs to go home, a family member, clean up, clutter free, make sure there's so much space so that they don't fall. You can install grab bars or rails by your toilet and the bathtub because they have to grab before they get up or sit on the toilet. It's all for safety measures. And then sit during showering. You might have to get a chair in the bathroom for them to sit. They need to sit during shower and while they're dressing. They should avoid bathing alone until they're safe to do so. Anything at all can happen again. Accept or arrange for help. Have important contact numbers available all the time. Wear non-skid shoes. There's special there's special shoes that are called non-skid. It prevents you from falling. Now, pace while ambulating to conserve energy. You're not going to get a marathon when you're trying to race. Just take your time and do your walk. No rushing. You don't get trophies when you're too fast and then you fall. And then use assistive device or brace as prescribed. Now, this one, our own people don't like to use the walker. Oh, they think they look older when they prescribe walkers or cane. There's a reason why you have it. Use it as prescribed, because when you use it, well, a time will come you might not even need to use it. So at the meantime, when you need it, use it when it's prescribed for you. Now, special care. We do have symptoms like aphasia. You know how they're talking, then all of a sudden you don't understand what they're saying. Now, when you have someone with this kind of condition, aphasia is a condition in which a person has trouble with either speaking, reading, writing, or understanding. This patient may not understand words when spoken. Stroke will do that to you. Or speak in complete sentence. They may not understand the meaning of numbers. How to help the patient with aphasia? Allow enough time for the person to speak. Provide 2 or 3 choice instead of open-ended questions. Example, do you want water or juice? Instead of, what do you want to drink? Encourage the use of gestures such as pointing, so that they can point which one they want. Allow extra time for them to respond. They are very slow, so you need a lot of time and patience for them. And then use simple yes or no questions. Get their attention prior to speaking. That's face to face. Make sure they're ready, they're listening, they're watching you. And ensure that one person talks at a time. Dysarthria. Sometimes they'll write the patient has dysarthria and they're like, what is that? Dysarthria is a speech problem caused by lack of control over muscles in the face and the mouth. A person who has dysarthria knows which words to use, but they may not be able to make the right sounds. It comes out differently. Meanwhile, they know what they're saying, but it sounds different. They may not control tone, volume, or speed of speech. Their speech may be hard to understand. They may drop or slur part of the words. Speak without moving the mouth. Sometimes you see that their face is so straight, but they're trying to say something. And then they seem confused. And how to help them? You allow extra time for them to speak. Reduce background noise. Repeat messages to confirm what you understood. Give feedback when you don't understand. Like the patient said something, you're watching. Over here for you, you don't understand, but you say, okay, let me confirm what you said. Did you say you wanted to go use the bathroom? Is that what you said? Probably that's not what they're saying. So try to confirm with them that this is what they said or not. Now be face to face when talking to them and encourage use of gestures, drawing. Some of them, if they want to draw, they can draw or writing to help them talk. Some of them will prefer to just write it because they're having problems, difficulties. Special care. We also have, so we've talked about aphasia, dysarthria, we have dysphagia. Dysphagia is the medical term for difficulty swallowing. This condition can make eating, drinking, taking medications, and breathing difficult. Many stroke survivors experience varying degrees of dysphagia at some points after a stroke. Some symptoms of dysphagia can be difficulty starting to swallow, choking when food gets stuck, coughing or gagging while swallowing, food getting caught in their lungs. That could cause a pneumonia. So be careful. Weak voice, drool, poor tongue control. Now, tips for living with dysphagia. The most common treatment is swallow therapy done with the help of speech language pathologists, SLP for short. When it's ordered, is very much needed. These special people can really, really help. Sit up straight anytime you eat or drink. Let the person try to reduce distractions at meal times, and they should eat slower with small amount of food. And then change food texture if you can. Hospital, some of them have to probably go all the way to puree. Puree, depending on what the speech and language pathology recommend, that's what they will have to take. And then make sure you have cleared all food from your mouth. That's the patient before they swallow. And then tucking chin like that before they swallow, or the head turned to the side while swallowing. Gone were the days that we thought doing it this way was the right way, but it's actually not the right way. They said when you tuck your chin, it's actually easier for them to swallow better. So you do what the speech and language pathologists assist you. But bottom line, when someone has dysphagia, please try to make the food as soft as you can for them so that it can make it easier for them to swallow. Special cares, emotional and personality changes can arise. Depression, fatigue, changes in emotions, and concerns about intimacy are some of the struggles they may face after a stroke. Depression, mild or major, is the most common change in emotion faced by survivors. Depression can keep you from moving forward in recovery. These people with depression needs to be monitored a lot because some of them become suicidal. If I can't take shower by myself, if I can't do this for myself, life is not worth it anymore. They want to end their life. So you really got to watch them a lot and make sure they're safe. And then symptoms of depression: feeling sad or empty, loss of interest or pleasure in usual things, sudden trouble sleeping or oversleeping, weight gain or loss, feeling worthless or helpless, and some of them cry all the time. And tips to help them keep them active: play games, watch TV, or listen to music together with families and friends. Make the most of rehab, celebrate the large and small gains. Like today, if the person did so well at rehab, give them a reward. Let's go out to watch a movie. Let's go do this. You did a good job today. Always encourage them. And then most of the stuff that happens with sex and intimacy, start slowly, perhaps with being close or cuddling. Create loving atmosphere. Find a comfortable position. Be patient, loving, and keep humor in your relationship. and talk to a counselor if needed. And then if there's weakness and spasticity means tight or stiff muscles or a limb due to brain injury. You know how they paralyze and then that arm can't do much. We do have, the doctor will write hemiparesis. Now, hemi means one side of the body or one limb. Paresis means weakness. So left side hemiparesis, that's the left side, or the right side hemiparesis, that's the terms we use. Tips to help: allow home exercise, plan given by therapists, and use device or tools prescribed by therapists. Anything they recommend that use, please use it. Family members, encourage them. They need all your full support. Don't let them feel like they're a burden. And then support and protect your weakened limb during rest and activity. Do not use furniture for support while walking. They try to grab on things while they're walking in the house. If you need bars or rails, try to do them. And then wash the affected limb daily. Wear braces and splints as prescribed. Following precautions for range of motion exercise. Some of them, let's say your grandfather, the elderly, if they're in a chair, you have to try to reposition them every 2 hours. They can't do that. If you don't do it, pressure injuries will start forming on the affected side because they don't feel anything. As a normal person, you remember when you sit for so long, involuntarily you just get up and shift your body. They can't do that. So whoever is in their care, like, try to reposition them, put the arm straight, put it forward, flex it, extend it, use pillows to support the affected side as much as you can. But every 2 hours, try to change their position when they're sleeping or they're sitting outside or wherever. And then take medications as prescribed. For the one who has a problem swallowing, if you have to crush the medication, crush it. Now, before you crush the medication, not all medications can be crushed. Something like if they order a medication like aspirin, enteric-coated aspirin, you cannot crush it. So you have to tell the doctor, hey, the patient, all the medications we're given have to be crushed. So they will have to check with the pharmacist to check if that medication can be crushed or not. So they can change it for you. We have the chewable aspirin that they can change it to so that you can just crush it and mix it with food, applesauce, put in anything for them to be able to swallow it and easier. So we do have this acronym, stroke is an emergency. We have this thing, if you find it, some people print it out. You can print this thing out. It's on Google, just keep it on your fridge. If someone, maybe you're a caretaker of a family member, a spouse or whoever, and they have any symptoms, you're not sure which one is, this one will really, really help you. This is our Act Fast. Any one of these signs could mean a stroke. If the face is droopy, you can see what it looks like. The arm, maybe they were just eating and all of a sudden the cup fell or a spoon fell. Keep an eye, and they're all warning signs that you can call 911 for. And I do have my references. And Siana TV Akbanami.
All right, thank you. Thank you so much. Wow, that was very informative. Very informative.
I hope it will help.